Well, it's fun. We actually, the students look at about 21 countries and look at the kinds of healthcare system that they have there, and then they analyze that particular healthcare system, but they analyze it within a cultural context, because a lot of our beliefs and our traditions and our values kind of play out in health and healthcare. And then they compare at least 2 or 3 of the countries to see what similarities and what differences there are. So it's a challenging class, but it's fun. Okay, well, you look at a country like Japan, for example. It's a smaller country, first of all, but they're very homogenous. And they share a lot of the same beliefs and traditions. But one of their beliefs is that healthcare is something that should be provided to everyone. And so, unlike the US, where we're having a difficult time struggling with a new healthcare bill that says, yes, those other, 40 million Americans should have access to healthcare. So we look at the healthcare system within cost, quality, access, and then what kind of cultural beliefs help them fashion the way that they provide healthcare.
Interesting.
I think I've heard several of them say that you can take one healthcare system and put it in another country, and it doesn't look quite the same. And but when you think about it, for example, the healthcare that's offered in California is sometimes not the same as that's offered in Alabama or New York or North Dakota. You know, there are varieties, and those varieties are based on the fact of not only the kinds of health problems, but what people consider most important in health and healthcare. So it's always kind of a regional take on a system that might be transferable to another country, but it's a little different.
Yeah.
Not so much background as, and they really don't need a lot of background in healthcare, but they have to really enjoy learning about different cultures, because sometimes that can be, it's bothersome sometimes. I gave an example one time of, I actually had students in Japan, and then I had them in Ireland. And in Ireland, it bothered them so much because we went to the maternity hospital, and they said, well, there are pregnant women over there smoking. Well, yes, and we used to do that in the United States too. But you have to put that in the context of, if allowing them to do that helps them to show up for their appointments, it's more important that they come to the appointment, and then you work on other things. And in Japan, it was, being able to walk in and get health care anywhere and not having to prove your insurance or anything else. It was just there and provided for you. So those things were surprising. I have taught online a lot in the last 10 years or so, and sometimes you get to know people even more than you would when you talk to them, but you get to know them in a different way. You get to know about them. But at the beginning of the course, I always start out by calling each student. And it's funny, their reaction, first of all, because we don't use phones that much anymore either, when you think about our culture. And so this semester I was calling students, and they almost all started out with, am I in trouble? Did I do something wrong? Why are you calling? Just to talk. Want to tell you a little bit about myself. And it's one thing when you put it in writing in a course, but it's another thing when we can sit down and kind of exchange some ideas and play off each other's conversation. So it's a good experience. So I always try and think of more interactive things to do in the course. I like to have videos and some things that make it more interesting. So one of the things I'm trying to do is to do a lot more interviews with healthcare providers from different countries, so that I can put it in the course and they can hear from somebody who's actually from there, from the country.